Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
How do you avoid it?
You're talking about avoiding liver disease?
Non-alcoholic fatty liver disease.
Diet.
Diet, yeah. Diet and exercise.
Diet. Lots of water.
Okay, and they talk about what kind of diet?
Everyone's raving about the Mediterranean diet, so I'll go with that.
Okay.
Low fat.
Mm-hmm. Low cholesterol.
Yeah.
No carbs.
Mm-hmm.
Yeah, and they emphasize that, and avoiding alcohol, of course, and losing weight. The higher BMI, the more likely you are to have fatty, non-alcoholic fatty liver disease. And then, of course, the thing we always talk about is exercise. Almost everything goes better with exercise. So, of course, the other thing that contributes to that is diabetes.
Good morning. Want some coffee?
Yeah.
I'm gonna mute you, man.
Right here.
Everybody losing weight and exercising?
No.
I'm exercising, but I'm not losing weight because I'm at my ideal weight.
Well, you are, but
You're lucky.
most people aren't.
I'm exercising, but it's not coming off as fast as I want it to.
Never does.
I've been the same weight forever. Up 2 or 3, down 2 or 3. So it's all the same.
You're
Janice,
blessed.
don't tell us that. Don't tell us that.
You're blessed. You don't realize how blessed you are.
Yeah.
Right. Everybody can't be like Darryl. Darryl and you think it's natural.
No.
Yeah. Well, we're in an interesting period of time in December, the end of the year, and 2021 has gone pretty fast, hasn't it? The older you go, the faster time flies.
That is so true. Time
Because
flies.
it
You've heard
takes
that
us
for
long-
years.
Because it takes us longer to do things.
Yeah.
Yeah. Yeah. I was kicked out of my email as a Thanksgiving present.
Oh, gosh.
Not that I asked for it, but anyway, I got out of it. So it was interesting to be without email access. You get so used to it, it's really painful. Yeah. Then when I got back on yesterday, I had about close to 400 emails I had to
Oh
try
my
to.
goodness.
Fortunately, most of the time was Thursday, Friday, Saturday, and Sunday, which are low periods. John, you ready with the?
Okie dokie.
Yeah. It's an exciting era because we all had hoped by now we'd be free of COVID.
Yes. And here we go again.
Yeah, here's an article that talks about an epidemic that is growing and growing in spite of everything else. And this is a lethal epidemic that killed over 100,000 people this year. And the problem with this is that fentanyl is now the drug that is causing more deaths than anything else. And it's interesting that this is a drug that is used to put people to sleep, and putting it in with the other drugs makes it lethal. And many people don't even realize that they have fentanyl in the drugs that they're using. And they take the dose and they just never wake up.
Question, Dr. Callender. That over-the-counter medicine, the antidote for overdoses, doesn't work with fentanyl?
Yeah, because fentanyl, when they started, gave that, people weren't using fentanyl, right?
I think it was used mostly for heroin overdoses.
Well, that's what it was used for. Yeah, right. Mhm. Because that was the drug of choice. And now over the last couple of years, and I think fentanyl is what killed the guy from Minnesota, the
Prince.
Prince, yeah. So killed Prince, yeah. And the thing about it is that they talk about drugs and the doctors being the source of drugs. That may be the case in some instances, but much of the opioid epidemic is fostered through economic people who are making lots of money, and the mules that they use are the people who get arrested. The people who are really responsible are rarely ever put in jail. So
And
this is
now
one
a lot of it comes through email now. Also, a lot of the fentanyl, the bad fentanyl, kids can get it. You can get it on online.
online. Oh, I see. That's sad. Sad. Well, it'll be interesting to see how we resolve this one, because it's wherever you go to the drug areas where they locate, you find them full with fentanyl. Now, this is interesting because we now have coronavirus home tests, which means that people do their own tests. If they're positive, only they know about it. And in addition to you getting too many false positives, you also get a situation that public health is unaware of people who are positive, which is not good. And so the one good thing is that whoever takes the test knows it, but the public health is blind to it, so it's a problem.
Let me ask a question, Dr. Callender. Sometimes doctors, you correct me if I'm wrong, sometimes doctors are required to notify the Board of Health when they discover certain diseases in people.
Not sometimes, always. Right, you have a requirement that if you have certain blood tests positive, you have to notify public health. That's a requirement, yeah. But that doesn't apply to people who do home tests who have no licenses, so they can keep it quiet.
Anybody know how much those tests cost? A home test?
They're a lot. They're like, I heard $55. Someone told me they got one. It was $55. I don't know if that's across the board or just where they purchased one.
Yeah.
The president is hoping to provide them free now with the outbreak of the new variant.
Well, if they're
The ones
doing
at Walgreens are 2 for $25.
Oh, that's good.
well, the problem is not so much that they have the test. The problem is that when they have the test, nobody knows about it. Because before this, you have a good CDC and count of who's positive, who's negative. Public health knows all about it. Now, if you have the home test, public health knows nothing about it. This sells 2 test kit for $13.98, but the problem is that who knows that when you're positive, and how many people are you going to infect because you're positive and you keep it to yourself? Is that Velma Scantlebury?
Mm-hmm.
Yeah,
Yes,
yes, that's right.
Hi, Velma. How are you?
it was.
Good. How are you?
Good to
Hello,
see you.
Dr. Scantleberry.
How was your Thanksgiving?
It was very nice. Thank you.
Good, good. How your girls doing?
Oh, they're doing great.
Okay, good. Yeah, we were just talking about the home tests and how this is going to be interesting nightmare for us to know who's positive and who's negative if they're doing all these home tests.
Yeah, that
So we
is
need to
true.
find a way to close the loop so that people who are positive somehow communicate that to public health so we can have a good idea of what's going on. Otherwise, it's a blind spot that needs to be fixed.
Dr. Callender, in some cases, when people are testing at home, um, they can package up the test results and send them in. One example is they have a home test for colon cancer, and you can, take the test, wrap it up, send it in, and get the results. And my question has to do with maybe that could be a requirement for the coronavirus virus test at home. They can take the test, wrap it up, and send it in.
Yeah, well, it still requires you to send it in.
Right.
And because of the stigma associated with COVID, that then requires people to be honest enough to do it. And that requires integrity, which isn't as common as you might think. But we do need to do something to try to eliminate that blind spot. Especially now that we have another variant, Omicron. Now, this is an article that talks about what's next. And it's interesting that we now have, 750,000 Americans dead from COVID.
780,000.
Up to 780,000. So it's possible we'll get up to 1 million, which is, and all of this, of course, are new records because previously it was 600,000 with 1919. And so this is new territory, not good territory, but new territory. And so the question is, how much immunity do we have? And we are fully vaccinated, close to 60% of the country, which is still not as good as we would like it to be, because we still have a lot of people who are not willing to be vaccinated. And as we have these variants, the danger of that affecting those who are not vaccinated becomes greater. And it appears likely that those people who are not vaccinated are, with the Delta variant, were 20 times more likely to die than those people who were vaccinated. So the question is, how do you handle that? And then you think of people like Kyrie Irving, who protested the fact that you had mandates for vaccines to save lives, because he felt that that was a violation of their rights. And it's interesting that the global vaccine inequity may be the real reason why these variants emerge. And therefore, it becomes even more important that you get as many people vaccinated as possible. But you still have people like Harry Irving, who really feel that there should be no mandates. And that, of course, it gets to the point where you look at the continent of Africa, where 95% of the African population is not vaccinated. And so that's the area where variants would develop. And so it becomes even more important now to get as many people vaccinated as possible, and also to deal with the global vaccine inequity, which still remains. We talk much about institutionalized racism, but we often don't recognize the global inequity that is ever present. We may recognize it, but we don't really have to pay a price for what we think. And this is a situation where the price we pay is you have variants, and these variants need to be addressed in a unique fashion. How unique, we don't know, because we don't know whether these variants will be susceptible to the vaccines or to the therapeutic endeavors that we use to kill off the virus. So this winter we will find out. And also we will see what kind of variants develop from the places that are not vaccinated. Any comments about anything I said? Because it's a great accusation I've made. And what are your thoughts about it?
Dr. Callen, I think you're right. December, we're going to find out a lot about how these vaccines are working. And the only thing I wanted to ask you about, you might as well include the flu in there too. We're going to find out how well the flu is working. The flu vaccine.
The flu vaccine, yeah. Well, it's interesting. This year, the flu vaccine is quadrivalent. In the past, it was trivalent. But so it'll be interesting to see. Also, the other issue that's going to come up is to whether the flu vaccine should be done by RNA rather than DNA. But that's another issue that will surface itself later. And the reason that comes up is because the ability of the flu to prevent the flu vaccine to prevent the flu is about 60%. We don't have anything like the 90% that the RNA vaccines have caused. So people are wondering, if you use RNA technology for the flu vaccine, would this result in a higher efficiency rate? So,
Dr. Callender, also though, historically, the immunologists have to guess as to which flu strain is going to be prevalent in a particular year, and they develop the flu vaccine with a good guess, I guess. And
no, not a
years,
guess. It's not a guess, though. They look at the flu in Australia and other countries and they use what they learn from that. So it's not really a guess. It's a calculated guess in a sense, but they actually look at what's developing in the Australia and other countries, and they then identify the vaccines directed against the viruses that they find in those countries. So that's how they do it. But the question still is, even at our best with that, we're doing 60%. And with the RNA viruses, we're getting up to 90% efficiency. So the question is whether we should use RNA technology for the flu viruses as well. That remains to be seen, but it's food for thought. Now, this is another issue that Tony Fauci brings up, but actually it's diverted resources from fighting AIDS and from fighting cancer and many other things. But particularly, he mentions the risk for HIV, which is another virus that that is deadly. We're fortunate that we have a treatment for it now, and it makes it a little different compared to the 80s when we had no treatment for it and people were dying. Now we have treatment for HIV, and if they take the drugs, they can survive. But be that as may, he's correct in that it's diverted a lot of attention from HIV to coronavirus, and well, it should, since the virus is killing people right now, and HIV is not killing as many people. So however, much of the attention is taken away from the HIV and is going to coronavirus, and sensibly, yeah. And so he's encouraging us to get back on target and to see how some of these RNA vaccines could be helpful for AIDS-related deaths. But the same inequalities that are affecting coronavirus are affecting all other diseases, and the institutionalized racism and global inequities are still problems that require us to face. And we have not been very good at facing those issues. Some would argue that it's a disgrace that 95% of the continent of Africa does not have the vaccine. Some would say that it's not that they don't have access to the vaccine, but it's that they don't have the mechanisms to take advantage of the treatment. However, all of those issues that need to be addressed and worked out. But these inequities are killing us. I guess that's the bottom line. Any comment about that? That outrageous comment that I just made? No comment? Okay. This is an article that talks about the reopening of music venues. As we know, we're having live concerts already, but they are requiring proof of vaccination. They haven't done that in theaters. They've done it in music venues, but and they don't do it in restaurants either, as far as I know. But many are thinking that this should be done. What are your thoughts about it?
Well, it's being done in New York. I mean, you can't go to Broadway or any shows. You can't go, you can't eat, you can't go into a hotel without showing your proof of vaccination. And for the theaters, not only do you have to show proof of vaccination, you have to show your identification also to make sure it's you. So it's not just a vaccination card. They have to verify by a picture ID that it's you. So that was quite interesting. So for New York, they're being cautious. You can't go anywhere without proof of vaccination. So that is an example that many should take. I went to Longwood Gardens here in PA to see the light show yesterday, and they're also required, even though it's an outdoor event, proof of vaccination with identification. So
Really?
yeah. So it's, places are beginning to be more cognizant of the fact that, we want to make sure it's you. So.
Very interesting, very interesting.
I was in New York and we went to a restaurant for my grandson's birthday, and they did require all of that Dr. Scantlebury just said, but there was no social distancing in the restaurant. We were piled on top of one another, and the restaurant was packed. And I was like, oh, do we really want to go in here? Plus the lines outside were, everybody was on top of each other. So it was a little cause for concern, but everybody was vaccinated. So.
Dr. Callender, I attended a play last month in downtown DC, and I had to have my vaccination card and my photo ID before we got in. So They were checking you out.
Yeah, they don't do that in the theaters.
Mm-mm.
They just want you to wear a mask and theoretically do social distancing unless there's a large crowd, and usually aren't large crowds. But see, the question they asked, how do you make money putting people in every third seat? That's the question. And which is more important, the making money or spreading the disease? And
Dr. Callender, I wanted to point out that this article is from February. Okay, it's just a long time ago.
yeah, it's
And,
changed. Many things have changed.
my experience being a performer in large crowds a lot of times, one of the venues, again, it was like 800 people in there, and you had to show proof of vaccination and an ID, but that was in September. So it almost seems like people are loosening up. The mask mandate has been lifted as of last Monday in DC.
In certain locations,
Yeah, except for public transportation, libraries, and any
and inside events.
and any businesses that wants to mandate vaccines in their business can do that. But back to performing in public and large venues now. And I think I told you we're doing Messiah for the first time at Shiloh for the first time in 2 years. And I'm going to report probably next week as to the requirements for, at least for the musicians, we have to have masks on. And that's going to be interesting. And as far as the attendees, I'll let you know if there's any kind of requirements. But that place has always been jam packed. I'm
Right.
wondering how it's going to work.
Yeah.
What's been a mystery with me is the football fields. How come you see very few people when you're watching TV with masks on, and that's the number of people who attend those activities is enormous, and to see very few people without masks, and yes, some of the fields are open and some of them are closed, but it's just amazing how they can be in there with no mask.
Well, I think the outdoor ones, they might argue that it's outdoor, and that's why. Whereas the indoor ones is inexcusable, but the outdoor ones, some will argue that, except for the fact that there's no social distancing at all.
No.
Yeah, which makes it.
I was in Atlanta for Thanksgiving, and there were very few masks in sight.
Yeah, Atlanta's always been that way, unfortunately. Yeah.
And the further south you went, I drove, and the furthest, the further south you went, the fewer masks you saw.
Yeah.
In Illinois, there's a mask mandate, but in clubs and restaurants, it's pretty much completely ignored. It's probably most observed in grocery stores, but now you've got about like a quarter of the people in grocery stores that are not wearing masks, and they're all white, and defiant. They don't want anybody to say anything to them, and that's their attitude. Like, you better not say anything to me.
Oh. Well, this, of course, now this new variant, as this article talks about, causes everything else to be reviewed, and makes everybody frightened by the name Omicron, because it's thought to be a highly transmissible virus, concerning even more easily transmissible than Delta.
Well,
The
Dr.
question,
Callender,
yes.
I have a question. It's interesting here in the DMV, where Prince George's County has reinstituted the indoor mask mandate. Montgomery County has done the same. I believe it's the same in Virginia, but not in DC. So with the public health issue, I mean, and with all of the transitory nature of the DMV, I mean, what can be done, or does it make sense to have a consistent regulation for whatever it might be relative to public health in the DMV?
Well, I think DMV, each of those areas have their own autocracy.
Oh,
And-
exactly. But that's
Yeah.
not going to stop. That's not going to stop a virus, and autocracy is not going to stop a virus. So, I mean, would it make sense to have consistent public health guidelines or whatever in an area like this?
Yeah, it would make sense, but it's unlikely to occur because the governors have the ultimate say about what goes on. Until that's addressed, the governors have the right to legislate. That's the weak spot in everything.
Right.
But
Well,
yes,
see,
it would make sense to do that.
It seems like the day after the mask mandate was lifted in DC, Omicron showed up.
Well, not exactly. And also the mask is lifted in certain locations indoors, not every place indoors, but some places. It's interesting how when Omicron was identified in South Africa, the South Africans felt very imposed upon because travel from there was deemed inappropriate, forgetting that by the time they announced it, people had been going from South Africa all over the world. And it's really too late, but some would say better late than never. And now we've seen Omicron everywhere. So, you know, one of the wonderful things about travel is that the virus doesn't go by itself. We carry it. And so banning flights from South Africa and other Southern African countries is interesting to do. But is it too late? And I think this is the Omicron. The problem with this new variant is that we don't know any of the answers about the new variant. We don't know its impact upon lethality. We don't know its impact upon the vaccine. We don't know its impact upon the different antiviral treatments. And so the real answer, what is known, is very little, except we do know that it has 30 different mutations and that it is more easily transmissible. But whether it is more lethal or whether the vaccine protects against it, or whether the monoclonal antibodies and other treatments protect against it, we don't know. And it's going to take us at least a week or so to find out. And so in the meantime, it becomes even more important to take advantage of masking and social distancing. And it makes sense also to impose quarantines and also to test people to find out if they have the virus when they come in. So I think this remains to be seen. We know what happened with the Delta. Now the question is, will the same thing happen with Omicron? And time will tell. And this is one of the things that requires patience. But in the meantime, we should continue the same practices that helped us with the Lambda and the Delta. So we have much talk about it, but actually we know that the 30 mutations Will that make the virus stronger or weaker or just more transmissible? Will it make it more lethal? We don't know, but we know that it is a major threat, and people have already passed it on all over the world already.
Dr. Callender, I want to say something, but I know Carol doesn't agree with it. And that is, maybe we need to start asking people where they're from.
Always ask that we do that anyway. That's a necessary question.
You're sitting next to a person on the plane, and you say, "Hi, how are you doing?" Where are you from?
Oh, you're talking about that. I thought you meant medical, because we always.
Yeah, where are you from?
Right then.
Well, yeah, well. Interesting, yeah, well. Whatever we say, they're going to implement travel restrictions, and whether they work or not, they're going to be put into place, because that's all we know how to do. I think there's very little question that the virus is already here, as we know, and so what we've yet to learn is how do we keep it from spreading, and we know what works, and that masking and social distancing work. So we need to continue that, and we need to continue getting vaccinated. So to me, it's just a matter of time before all of the countries have the Omicron. As long as we have planes and we have travel, it's a necessary evil.
We seem to forget the last year when the United States.
Unfortunately,
We seem to forget that last year when the United States was a hot spot for COVID, American travelers were restricted to traveling from other countries.
Velma, you were saying?
no, I was saying, unfortunately, the bulk of the people who want to be vaccinated are vaccinated. And those who don't want are still holding out, even for jobs that are requiring. If you look at the federal government and the different forces that were supposed to get vaccinated, whether it was the Army, the Navy, all those different workers, they're still holding out. They may be 90% or 95%, but there's still at least a few thousand in each sector who are claiming religious or medical reasons for not getting vaccinated. And also those parents who are not allowing their kids to get vaccinated because they're also against vaccination. So is that group will be still continue to hold out. I still know many teachers who, because they have access to twice a week testing, continue to do the twice a week testing and not get vaccinated because it's made easier for them to just go into work and get tested, as opposed to the rest of us who would have to find a way to get tested on a regular basis if we refuse vaccination. So that's, unfortunately, that sector of folks who will probably hold out and be those who get infected and require more medical services.
Sadly, but true. And well, what's the future?
I was even told that one of the surgeons that do some of the surgeons that Christiana Care are still holding out and are not vaccinated. So there you go.
That's
Wow.
insane.
Yeah, insane. Wow. Wow. Well, it seems to me that many people might recognize that with all of these variants coming out about, that maybe they might change their minds. You think there's any likelihood of that?
I don't think so.
Yeah, I think you're right. That's
Maybe.
sad.
Maybe if somebody in their families get sick or something, they'll decide to do it after that.
Mhm.
We got someone in the Stevenson family that changed their mind.
We're all vaccinated, almost boosted, but we're all vaccinated.
Yeah, but I'm saying we got one in the family that changed their mind.
Yeah. Yeah. Definitely.
I wonder if many others in his in the army have changed their minds. That's the one area that seems to be resolute about not being vaccinated.
I think for the requirement to be tested on a regular basis, if you had to pay for those tests, would they then change their mind? Everything's free. Why not? I'll go there and let them do a swab or whatever it is. But if you have to pay, maybe they'll rethink it.
You have to look at the composition of the Army and the military now. A large percentage of the military now is composed of right-wingers. That's a place that's attracting a lot of people who are anti-vaxxers and who have, well, if you just look at the number of people in the January 6th insurrection, the numbers that were connected to military in some way, which is kind of a microcosm of the military in general. So I think that reflects a lot of the political views or the politicization of the vaccine.
Well, this is an interesting article which says that the variants that this doctor dealt with had very mild symptoms, but they can all be treated at home. Of course, those we don't know if that will remain that way, but it's going to be. We'll find out. So, because it may well be that the 30 mutations have weakened its ability to kill people, but still cause the disease, but may not be as lethal. We shall find out. But 2 weeks, waiting 2 weeks is a long time, but that's patience is a virtue. Some people are ready to lock down, but so far we don't have any evidence that we should. We know we should continue the same practices, but we don't know about the lockdown or not. One crisis after another.
I don't think we're ever going to be able to be virus free. There's always going to be another virus.
Yeah. And so this is not surprising. The only question is, where else will it pop up? And will the vaccine work against it, which we hope it will. Fully vaccinated traveler has mild symptoms.
Well, if it follows a history of the Spanish flu, that means it was active for a little over 2 years.
Right.
And then we went for another 100 years before we had something major. And so if that's the level of always having a virus, that's not bad. That's pretty acceptable.
Yeah. Yeah. Let's put a lot of pressure on Fauci, and then of course the NIH director stepping down as of the end of this month. So Francis Collins. Wonder who will replace him.
I had a question. How would they even think that there could be a variant? What would cause the doctors to even think that there would be a change in the virus?
Because it was predicted that those areas that don't have the vaccine, that's where the virus is that's where the variants will pop up from. So it was anticipated. But it's not surprising it. And that's why the global inequity becomes an issue. Because if you have a global vaccine inequity, the areas where there is no, people are not vaccinated, is the area where the variant is going to pop up. That was a prevalent thought from Jump Street, so to speak, which is why there was a mandate for the vaccines in the first place. So it's going to be interesting to see what this does to our effectiveness of our vaccines and our anti-vaccine therapies, because that's really the bottom line. Is our vaccine protective against this variant? And if it is, then we're in good shape. If it isn't, then we have other problems to look at. And this next 2 weeks is going to be pretty painful to try to wait it out.
Dr. Callender, what about Darwin's theory of mutation? How does that come into play?
Well, and survival of the fittest is Darwin's theory, and I don't know that it has much to do with this concept of the unvaccinated being the area where the variants will pop up.
Yeah, but I'm mostly talking about the fact about evolution, where things are always going to evolve. And so the same as with viruses, they're going to evolve.
I know, but they evolve along certain patterns, which we've identified the pattern is it's going to occur in areas where people are not vaccinated.
Okay, thank you for that.
And that's the evolution that, yeah.
Okay, thank you.
Now, it's interesting that they won't take action against until next year, except next year is next month. January is not far, so.
Yeah.
96% of the workforce is already compliant. That's an interesting number. And as we looked at some of the numbers a couple of weeks ago, it's about 1% of the people were not vaccinated and thought they had reasons why they shouldn't be.
Dr. Callender, what kind of medical exemptions could you have for not taking the vaccine?
People who have allergies to vaccines, who have demonstrated that they have allergic reactions to vaccines, people who have religious objections because some of the components that they identify are against the religion to take. I think Darryl looked this up before, and I think that those were the major ones. People who have allergies and who couldn't actually take the vaccine because they've had exposures to substances that are in the vaccine. So those are legitimate medical reasons for not taking the vaccine.
I was just wondering what could be in this mRNA vaccine that could cause a problem. I thought it was just plain water, sterilized water.
No, there's other elements of it. I don't know all the elements in the vaccine, but if you're allergic to one vaccine, the concept is that you're likely allergic to all of them. So,
Dr. Callender, what about people who have terminal cancer?
what about them?
They shouldn't, the vaccine probably wouldn't do them any good.
Well, I don't know that because the question is, do they have? They should be vaccinated, I would think. There's no reason not to vaccinate them. So that would not be a reason unless they have. No, I would think they could be vaccinated because people who have terminal cancer can sometimes survive for months. So I would think that
Yeah, now, another
they
question.
should be vaccinated.
Another real quick question. Colin Powell had some underlying issues too.
He had multiple myeloma, which is associated with hypogammaglobulinemia, which means you don't have any antibodies, right? So diseases that destroy your antibody ability to fight off infections, they probably need to be vaccinated more than any other group.
Yeah, so Colin Powell was fully vaccinated, including the booster, yes.
Right, right. And so there's no reason not to vaccinate those people. Even though it's unlikely to be helpful, still give them a chance. So I would be for. Go ahead.
Dr. Callender, basically addressing what John Buchanan is saying. You don't have to have a proof of documentation on any paper. All you have to do is just say you're allergic to it, and nobody can just say you're not, or you say you're religious. And do they ask you to prove what church you go to that proves it? Because
Yes.
all I'm hearing is just verbal.
No. For example, it depends who you go to, but they examine your reason. They even examine your medical reasons. And there's some people who have had medical reasons and they have not accepted them. And some people who have said they had religious reasons, they have, for example, in the NBA, one of the players said he had religious reasons and they reviewed his reasons and decided that they were not legitimate and he was required to take the vaccine. So you don't just say, I'm allergic to it. You have to demonstrate that you have had a vaccine and you've had a response to it. And what kind of response?
Dr. Callender, I was in a conversation recently with someone who was saying that a friend of this person's who was a transplant recipient was told by the doctor that the vaccine had destroyed all of her antibodies, so she couldn't go out any place. And I said, that doesn't sound right to me, but I don't know. I know that you have talked about encouraging all transplant recipients to get the vaccine. Is there any validity to any of that?
Well, the only validity is that immunosuppressed people, some people will require a 4th dose and maybe even a 5th dose because of the transplant and the immunosuppression that they get. They do not mount antibody responses. And so they would need more boosters than anybody else. Now, as far as, and there are some centers where they will not transplant you unless you are vaccinated,
right?
Because of the fact, but I don't know of anybody for whom the vaccine is the reason that you don't have a response.
Okay, that's what I thought too, but wanted to check it out. Thank you.
I know of no evidence that that is the case. Velma, you have any thoughts on any of this?
No, you are correct. I mean, often, we know that if you're severely immunocompromised, whether it's transplant medications or cancer, you're not going to mount a response if you're on those kind of medications. And that's why they may not have an antibody response to the vaccine, just as they would not have an antibody response to some other vaccines too. So it's not the vaccine that eliminated the antibodies, it just have the inability to make antibodies. My neighbor down the street have a severe skin disorder, and after his vaccine, all 3 of them, he's only had, even after his booster, 8% of antibodies. And that was just taking medications for a severe skin disease.
Yeah.
Thank you. That's what I thought, but I wasn't, I needed to have more validation with for my thoughts.
Dr. Walton, I think I heard you say that doctor said that the vaccine caused
Yes.
the problem.
Yes.
That doesn't sound right to me.
No, it didn't sound right to me either. And I couldn't refute it other than just share what I knew and what we had talked about here, but that's what I thought. So that just validated for me what I was saying in the conversation. So.
Well, I think today is December the 2nd, so by next week, maybe we'll have some more data on the Omicron variant. I hope that what they're saying is true, that you only have mild symptoms and the lethality is not going to be, and also that it will respond to the vaccine and to the treatments that we already have for COVID. Best news.
I still have the question, why would anybody even think that there would be a variant in South Africa?
Well, everybody knew that there would be variants because that's the nature of viruses. That's the nature.
I'm aware of that. I'm just saying, in this case, how did they recognize that there was something different going on?
Oh,
because they genetically test the strains. As people get infected, they randomly look at the genetic makeup to see how it differs, even from the beginning. So you know that in the beginning you had the virus, and then you had the alpha variant because the genetic makeup changed. And as Dr. Callender said, that's to be with the flu virus, even though we don't hear about it, they're constantly monitoring the different strains genetically of the flu virus. This is how you come up with the vaccine, by changing the antibodies that you're given for each flu strain, which may be vary from year to year. So we don't hear about it, but they're testing and looking at the various genetic makeups more consistently in South Africa. They have better screening and better, they do it on a regular basis more so than probably here, because they're only, I think that 42% of the population is vaccinated. So they have higher rates of infection also. So it's just genetic monitoring as they do on a regular basis as expected. So that would be what I would say.
Thank you very much. That's an awesome explanation. In other words, they're constantly looking anyway.
Right.
Okay.
The other thing, Dr. Callender, is that we know that living things mutate. So that's the other thing that causes us to suspect that there are going to be variants.
We know they're going to be variants.
Yes.
Yeah.
So
and there are other variants that are not mentioned that may be irrelevant. We know they're put into categories: those that you worry about, those who you don't worry about, and those who just skip by. As you go to Alpha, Beta, D, E, F, G, H. There were many in between before we get to Omicron, but they weren't significant, and they didn't seem to make a difference in terms of how often they pop up. So when they become concern in terms of prevalence and degree of illness, then they begin to put them on notice, but not every variant is put into the public's eye.
To me, that's the
Okay,
scary
that's-
part, because there's probably a ton of other variants that just haven't popped up yet. Golly.
There were,
Yeah.
because we got from Delta all the way down to O. So
Yeah.
you were going through the Greek alphabet. The ones that they tell you about are the ones. So it's just like the flu. There are many different flu variants. They give you a combination of your vaccine to cover the most prevalent, but you're still only going to be 60% protected. You may still get the flu, and people will say, you know, I got the vaccine and I still got the flu, because there are going to be other strains out there that may not be part of your vaccination dose. You know, you may not be protected against that flu strain. A new one may come along the line. You know, your relative comes from Canada and they bring a different flu strain, and you get the flu because your vaccine wasn't included in your protection in your polyvariant strain when you receive your vaccine. So people say, well, why get the vaccine? Well, it covers certain strains, but not all strains, but hopefully your antibody load will help fight it off. Just the same thing with coronavirus. Those who are vaccinated versus those who are not vaccinated will get equivalent loads of virus load, but if you're vaccinated, you're able to fight it off, and your course may be shorter because you have antibodies to help fight it off versus those who are not vaccinated.
Velma, answer this question. What percentage of transplant centers will not transplant you if you're not vaccinated? And help them, explain to them why this comes about.
Well, I think right now, I don't know about any transplant center. I mean, unless it's a life-threatening transplant, like it's heart transplant, and you didn't have a chance to get vaccinated. But they're trying to get all patients vaccinated before they get to transplant, because your chances of having antibodies and being able to, let's say you got infected right after transplant with the virus, and with any virus, it's going to take over your body even worse with immunosuppression. So the goal then comes, you know, with this virus, now that you have all these immunosuppressants on board, you have no fighting ability. And that allows the virus to multiply. And so what happens to save you, we have to stop immunosuppression. And now you put that organ at risk of rejecting, because you're trying to save you from viral sepsis. Now that this virus is all throughout your body and you have no fighting ability. So the mortality is high, certainly, for those who are unvaccinated, and the risk of getting coronavirus early on after transplant. And that's why it's not just the patient who needs to be vaccinated, it's their caretakers who need to be vaccinated. And that's why it's so important to tell patients. People get upset when you say you're transplanted, but your relatives can't come visit, you know. And so you're then Zooming your family at home and giving them instructions, because you don't want that patient to be exposed to the virus. And so you want them to say, even though you're transplanted and even though you're vaccinated, your antibodies levels are still going to be lower, and your risk of contracting the virus is going to be higher. So that's the goal, is that to minimize that, get you vaccinated prior to getting your transplant, give you some antibodies before you're totally unable to make antibodies after the transplant, and then keep you safe from your relatives and your unvaccinated crowd after transplant by limiting exposure, you know, bring you into clinic less often, only bringing one person who is vaccinated with you, that sort of thing.
Does that clarify for many of you?
Yes, it does.
Thank you, Velma.
Yeah, no problem. I mean, they're even in Houston now, they're beginning to they have to shut down elective surgeries now because of the surge of virus and admissions to hospitals. So, we're going back as we get into the cold months. We're now going the other way for some of these places. And, Houston was that lawsuit with the hospital workers sued because they didn't want to get vaccinated and it was mandated. And that was thrown out because they mandated all their staff to get vaccinated. And they actually just at the Methodist Hospital just terminated or relieved the practicing physician of her right to practice there because she was prescribing or mandating what's the parasitic medication for her
Oh, yeah,
patients.
yeah. Divert,
Ivermectin.
yeah, that's it, yeah.
Yeah,
Everything.
Ivermectin.
Yeah.
Yeah, so I think it's important, not so much for patients, but also hospital workers. And, you can transplant a patient, but if the nurses and the doctors that are taking care of you are not vaccinated, then you still run the risk of getting your patient, then you're exposing your patient. So is that fair? No.
Thank you, Velma. Real good. Any other comments or questions about that? Well, the thing that is a little scary about this is that this means that the first part of 2022 is going to be associated with more COVID stuff. And that's not desirable. We were hoping that 2022 might have been free of it, but we shall see. We shall see.
I think one of the things that, I think other countries may start, I think I just saw something pop across my phone about Germany, limiting travel to vaccinated people. I mean, the question is nobody wants, rather than restrict, and even in terms of people coming to the US and going places, at some point, the airlines have to say, I'm sorry, but if you're going someplace, you have to be vaccinated. I know that doesn't seem fair, but it limits the spread of the virus from one place to another. And certainly make you feel safer if you're traveling to know that people sitting around you are vaccinated.
Yeah.
Well, airlines aren't likely to do it because they want to sell ticket fares. That's going to have to be governmental regulation.
Economics. Yeah. The love of money is the root of all evil. Unfortunately.
But before, didn't they have mandates of certain vaccinations you have to travel overseas or to certain countries?
Yes.
So what is so different now?
Because we talk more about being a democracy, but I think to me, the behavior should be the same. That's my view of it.
Yeah, well, you look at just about all the mandates that we put in place, they hold up for a little bit before a court blocks it. And then it has to go to the next appeals level to either reinstate or further block the mandate. And so, mandates are just always temporary so far.
To me, the scary thing is, okay, we're looking at South Africa, but that's a microcosm of the whole world. And of all the unvaccinated people in the world that are like little test tubes for growing new variants, it's no telling.
Except that Africa is not a microcosm of the world. As I mentioned before, 94% of people in the continent of Africa are not
vaccinated, right?
So it's not a microcosm. It's a global vaccine inequity, which really is what must be stamped out.
But all I'm saying is that so many people in the world are unvaccinated. And so they're you know,
That's correct. And that's the problem. That's where the global vaccine inequity becomes an issue. And stamping out global vaccine inequity is the biggest problem. And how do we get the vaccine to all people in the globe? I used the continent of Africa as an example because it's the continent that has the least vaccinated percentage, with 94% of the people in the continent not being vaccinated with. And they talk about 2.4 billion Africans. And so it's an example. Now that may be applicable to a less extent in some other South American countries. But it's just that Africa is the continent that has the highest percentage of people who are not vaccinated. And that global vaccine inequity, I think is likely to kill us if we don't stamp it out.
Yeah, and
We
it's
haven't heard-
interesting because you have places like Morocco who has 130 doses per 100 people, so they have access, in Cape Verde. And then you have other places like Congo, which have only 11%, Uganda 10%, Nigeria 5% of people are vaccinated in Nigeria, 7% in Ethiopia. So when you look at the bulk of the places, it's just, I mean, it really is, you know, Ghana 11%. People talk about going to Africa and still having these trips, but you're realizing you're going into an area that is heavily infected because of the possibility of variants, because they don't have vaccines from that standpoint. So it's very troubling.
I had a question about India. We haven't heard about India in a while.
Well, they have a higher percentage of vaccinated than those other places. I don't know exactly what it is, but I think it's in the vicinity of the 30 to 40%. Unlike the 5 to 10% we're talking about in the continent of Africa. Any other questions? Is this the last one, John?
That's it, yes.
Okay. Any other questions that you want to talk about? You know, one of the other issues that we don't talk too much about is the ethics of the fact that we have third world countries that do not have access to the vaccine. And that's a concern, and I don't know what we can do about it. But I think if we recognize that global vaccine inequity is killing us, that we purpose to do something about it, we can overcome it.
Yeah, definitely. I'm just looking here to say that India, where more than 70 to 80% of those eligible for vaccines in India have been vaccinated. So they're doing better.
I got a comment about Africa. I'm looking at a current internet article from September 21st, 2020. And it says the United Nations estimates a total fertility rate of sub-Saharan Africa at 4.7 births per woman in 2015 through 2020. So, you know, it's like if the variants that come out of Africa, if they kill the rest of the world population, the birth rate is so high for sub-Saharan Africa that population will persist because the birth rate is much higher than any disease can wipe out, just because of the greater fertility of Black folks.
Interesting.
Yeah, but you also have to consider the mortality, the child in a lot of African countries, which is also higher too. So the fertility rate may be high, but the the maternal mortality and birth mortality is also higher than the United States. So half of those kids may survive.
Yeah, so
I think-
when you get past the attrition from COVID, from infant mortality, from AIDS, that 4.7 is still a pretty high mark. That once you delete the attrition, the population still grows faster than any other region or country in the world.
That is interesting. That's right. China restricted it, right, to what, 2?
Yeah,
Yeah.
2 children per family, and they've just recently lifted that restriction in the last 5 years.
Yeah.
Currently, Europe has a birth rate of 1.7. Just to put it in perspective of where that 4.7 lies for sub-Saharan Africa.
Wow, that's amazing. Yeah. Okay, well, thank you very much. And it's so exciting to have our guest, Dr. Velma Scantlebury, to join us. We are thrilled that you chose this morning to join us, and we can't thank you enough. Welcome.
No problem. I've taken more time for myself now.
Enjoy.
Great.